Experts show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning to the most beautiful city in the United States, San Antonio. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. I'm telling you, I am so excited about this morning's show because, first of all, I'm on Medicare and I want to know what's going on in Medicare. And we have the greatest agent who handles the entire San Antonio area, New Brunswick, San Marcos. And we're going to be learning about 2027 today. Good morning to, I think, one of the top agents in the country, Susan Shimp. Good morning, Susan.
Good morning. Thank you for that great introduction.
Hey, well deserved. I got to tell you, you've kind of rebranded your agency. It's now the Signature Senior Advisors with Medicare Gals.
Right. That's right. I've grown a team and we've expanded. And so we wanted to let people know that we do just more than Medicare. However, our focus is Medicare. So we are definitely your advisors.
Beautiful. And you know, we're talking about what we're going to be talking about this morning. And you shared with me that Medicare just approved 2027 final rules for Medicare plans. But before we go to that, tell people about your agency.
So we are a local agency, been in business since 2015. We are education-based. We help people learn the ABCs of Medicare. We teach them about the ins and outs, all the plan options that they have. We help you enroll into Medicare. We are your guide to basically everything Medicare. So we hold your hand every step of the way from enrollment until years later. So we are a one-stop shop for you, and we would love to help you.
You know, Susan, I've shared this with you many times. Listen, I am telling you that if you do not have an agent, a good agent, to walk you through all the steps of Medicare, you're going to pull your hair out. Look what happened to me. I pulled my hair out. But I'm telling you, it is so important because I had a horrible agent my first year, and it cost me dearly. And I know you see these ads on TV, and you call the H insurance company or whoever. And first of all, they're only going to tell you about their company. See, with Susan, she represents a lot of companies. So you're going to be able to pick different plans, not just one. Correct?
That's correct. I'm a licensed independent broker, which a broker is basically contracted with all the insurance companies. And we're your fiduciary. We are not indebted to the insurance companies. We're indebted to you. So we help you find the best plan that's based on your doctor's prescriptions, your finances, your health. So we are contracted with probably, I'd say, more than a dozen insurance companies that are available around the country.
And, Susan, I got to tell you, even if people are already on Medicare, that doesn't mean the company they're with that they're going to be even offering Medicare in your zip code next year.
That's correct. And that's something we'll talk about in the 2027 final rule that's coming up, because there's going to be service area reductions, which means plans will be terminated.
Wow. Well, let's get started. We're talking about 2027 final rule for Medicare plans next year. And I guess there's some bad and there's some good in it.
Yeah. So April is the time of year that CMS, which is Medicare, decides the final rule for the next year. So they just announced it last week. And basically, what they're doing is they are lowering drug costs for the consumers, but they're going to increase oversight for the Medicare Advantage plans for the insurance companies, which means they're going to tighten the payments that are made to the insurance companies, and improve consumer protection. So, what this means is basically lower prescription drug costs. You're going to have more predictable and capped spending on your prescriptions, which is going to be less cost for consumers, more cost for insurance companies. Okay, so that's where they're going to lose their shirt. They're going to probably reduce some benefits due to the fact
Oh,
that now they're going to be increased cost of medications for the insurance companies. That means the benefits, all those little fancy stuff like the over-the-counter cards and the fitness and the dental and the vision benefits, those either may get reduced or cut altogether. Okay. So that's a lot of people like those, and unfortunately those are going to be on the chopping block.
wow. I mean, your opinion, where do you think it's going to be cut at? Any idea?
I bet you anything it's going to be on those over-the-counter cards. That is
Ah,
the number one call I get every single day, literally daily. I get calls on, I want that grocery card. How do I get more benefits with the over the counter? And it's like there's just so much out there that is trying to lure consumers that I think that if they pull it back, then therefore there won't be as many people calling and trying to switch people's plans because of all these extra benefits on the over the counter.
so I get $35 a month, which nowadays
Is not much.
doesn't go very far. So do you think I might be losing that?
It depends on the plan. So, chronic plans, if you have a chronic condition, okay, chronic conditions, depending on where you are in the country, but here in Texas, we look at diabetes, congestive heart failure, cardiovascular disease. If you have one of those three chronic conditions, you may be okay because they're going to focus on all the chronic conditions, and those plans are going to get probably more benefits. But the people who don't have those chronic conditions and don't qualify for those plans, those are the people that may be cut.
Mm. Susan, I think I talked about this on the last show. 2 years ago, I got an eye exam and I got glasses, and it didn't cost me anything. About 3 months ago, I went in for the same eye exam and had to have new glasses, and it was 135.
Mm-hmm.
That's just in 2 years' time how it's
Mm-hmm.
gone.
Yeah.
But what's scary though, Susan? You hear that these insurance companies are making millions and millions of dollars. That's the part that I get letters on, which I don't know why they send them to me. I have no idea, but that's what the letters say.
So yes, they do make millions of dollars. And the problem is with these new rules, they're not making as much millions of dollars as they
Mm.
want to, right? So, in order to continue their high profits, they want to reduce benefits for the consumers. So that either gives them more money in their pockets and allows them more flexibility. What they're also doing, and I'll tell you, this also, Medicare sets our rates, but these insurance companies can cut our commission, which is our compensation to help you as the
Oh,
consumer. So they are also cutting our compensation to help you. So that means, I mean, yes, we are a job, right? And we don't work for free.
right.
However, we do our duty to help you be in the best plan. And if it means that the plan doesn't give us any compensation, I have done that. I have literally enrolled somebody in a plan that does not pay me because it's the best for the client. And so they're, cutting benefits to keep their costs low, cutting agents' compensation to keep their costs low, all to make their pockets bigger.
That's really sad to hear, Susan, because You guys do such incredible work. I didn't realize it until I got through my first year of Medicare that how important your agent is.
It is. And I mean, there's tons of agents out there, right? And everyone's
Yeah.
got their own little quirk and their own little way they work. However, some people are in it just to make the money, right? Some people are in it just to help. And that's where I fall. I fall on the helping side. I have a servant's heart. And, it's wise to help somebody even if you don't get paid, because you know why? That comes back tenfold to you. So I get a lot of referrals, and a lot of my business is word of mouth because I have done right by the client. And so, that's the good thing is most people are, just in it to sign somebody up, but I'm in it for the long haul with the client.
Well, I got to ask you this because I learned customer service is so important. And, you just shared with me today that you wrote a book in your spare time, I guess, Susan.
Well, I helped
Tell people about your
co-author a
book.
book. Yeah, I helped co-author a book. It's called 64 Plus, Your Ultimate Guide to Medicare and Retirement Planning. Okay. So I am offering a free copy to everyone who wants one. You just need to text me at 210-767-9876 to get your free copy. Again, that's 210-767-9876. Get your free copy, learn about Medicare. I mean, this is a really good informational, educational book that teaches you before you get confused.
You know what, Susan? I don't think people who've never, um, you know, gone into Medicare, I don't think they realize, of course, they should, it's a government, but they don't realize how much is involved. Like in your work, which you have to do to help each one of your clients, there is so much just who the doctors are that are going to be in your group and what
Mhm.
is covered, what isn't covered. I mean, people just don't know. And that's why, again, it's so important to have a great agent like Susan. And I know, Susan, customer services is extremely important to you.
Yes, me and my team, that is one thing we pride ourselves on. I have concierge service. I have a concierge um, client coordinator, and she basically is my first gatekeeper when it comes to answering clients' questions. So we answer you within the same day, 24 hours. You get us. You don't get a recording. You don't get a call center. You get our personal cell phones. So we pride ourselves in making sure that your questions are answered in a timely manner, and so that you're not confused and go off, doing something wrong and making a decision that could hurt you.
So I guarantee you there's a lot of people who are on like Medicare Advantage, like I am right now. And how is this going to impact them?
So it's going to impact them. I mean, the prescription costs are going to get lower. So anyone with high prescription costs, like for chronic conditions, those are going to get a little bit cheaper for the consumers, but it's going to affect the copays. The copays will probably increase. Your benefits, your extra ancillary benefits like the fitness over the counter, vision, hearing, dental will probably be decreased or eliminated altogether. And then also, depending on your zip code, this is the key. Depending on your zip code, there will be plans that will terminate. So that means it's called the service area reduction. And so what that means is they're not profitable in that area. So they will eliminate a plan so that they make more profit elsewhere. So 2027 is going to be key to annual review your plan. It's a must. You must do it every year, but for sure coming up in 2027.
Susan, I don't know if you know this or not, but first of all, we're dealing with a certain age demographic now. And we get so much mail, even from my Medicare plan. I get so much junk mail, and I got to tell you, I toss most of it away. I think
Good.
this is one of the reasons it's going to be so important to have a good agent like you, because I might lose coverage and not even know it because I
Exactly.
didn't read the mail.
Exactly. And a lot of people, because there's so much mail, you just toss it or don't open it. And some of that
Yes.
stuff could be important from your insurance carrier. Like, hey, your plan's terminating. And what
Yeah.
happens if you don't read it or you don't talk to an agent and you don't know that your plan's terminating come January? You could be without a plan. So it's important to kind of like, the postcards from the insurance companies, the cardboard ones, those you can toss, right? But it's the ones in the envelopes that are specific to your plan that you definitely want to read, because those are the ones that are going to be important. And guess what? If you don't understand it, you can always call us and we'll decipher all the jargon for you, because sometimes it's not put in layman's terms and you're like, what the heck does this mean? And we can decipher it for you.
So the second most asked question that I get is, I'm first going into Medicare. This is, I don't know why they ask me. And we send ones from your area, but they want to know, when should they start contacting you? At what age or their birth date?
So I always suggest maybe 6 months before you turn 65. That way you can start planning ahead and getting information. And technically, we can probably start enrolling you 3 months ahead. You can enroll into Medicare at least 3 months ahead of time. But 6 months before you turn 65, just to get those wheels turning and figuring out, hey, what is my option? What kind of plans am I looking at? I would say 6 months out, but 3 months is when you can actually physically enroll into Medicare. So, within the 3 to 6 month time frame.
We're talking about tossing things to the garbage. This seems like it's one of those years where people really need to review their plan, even if they normally don't.
100%. And you should do that every year. But, as things get more tight with Medicare and the insurance companies, that means benefits are going to be reduced. So you definitely want to make sure that you review October 15th through December 7th. I know it's far away. It seems like it's far away, but it creeps up very fast. So you'll be getting a lot of stuff in the mail. Again, a lot of stuff in the mail, but look for the stuff that's pertinent to your insurance company and open it, look at it. If you don't understand it, call us. We can come to you. We
One of the
have
things
an
that I want to get
office.
in, one of the things I want to get in before we leave is, I actually called my Medicare plan corporate because I wanted to see for the show. I don't know if this will surprise you or not.
Nope.
I called 3 different times, Susan. I got 3 different quotes. Does that surprise you?
Not at all. I always tell my clients, never call the insurance companies, call me first, because they're going to give you all different answers and they're probably not even correct. They read off a script, they deal with nationwide insurance plans, they don't deal locally with the plans that are in your area. So they're just reading off a blanket script, and they're not really licensed. They're very they're just, as it's a call center. So you're just calling somebody blindly. So yeah, it doesn't surprise me at all.
Susan, we got a few minutes. What is the biggest mistake people make when it comes to their Medicare plan?
I think the biggest mistake is not reviewing with an agent. You can do it online, absolutely, but if you don't know the ins and outs of how these plans work, your doctor network, because doctor network is definitely probably going to change for 2027. So if you
Wow.
don't know, if you don't know what doctors are leaving the network and you just assume everything's fine, you could be in for a surprise in 2027. So the biggest mistake is not reviewing, and not reviewing with a local agent. Local is key.
Wow. I got to tell you, Susan, we have other shows around the country we do. I got to tell you, you are one of the best. You go to these conferences all over the country. We understand you're going to Destin. You're going to be going to Vegas for a conference. I got to tell you, you are probably the most up-to-date agent, and the people in San Antonio are so lucky to have you. Please give Susan a call. How do they reach you, Susan?
They can reach me several different ways. You can call or text me at 210-767-9876. You can go to my website at www.signaturesenioradvisors.com. I'm also located in New Braunfels. My physical office is in New Braunfels, right by Buc-ee's. You can't miss us. And I also can do home appointments for you. So we can do virtual, in home, in office, however you please.
Susan, we are so lucky to have you. Susan's with us every month. You can also go back and watch the show or listen to the show on iHeart or YouTube. Susan, thank you so much. Great information. I knew this was going to be a great show, and we'll see you next month.
Take care.
God bless. That's Susan Shimp. I got to tell you, folks, you've got to get a good agent. Susan's amazing. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.